myself Dr. Poonan Nanwani. Today we'll discuss histopathological changes in Behcets disease. It's a very rare disease, but histopathological features are very typical in this case. Actually, this is not a disease, it's a syndrome. It affects various organs like patient presented with multiple recurrent ulcer and oral area, genital area like after stomatitis, recurrent genital ulcers. Patient heal ulcers are healed gradually and then again scar and then recurrence after few months. So if there is a multiple recurrence within a 3 months, 3 to 4 months, and in 12 months if you get 3 to 4 times of the recurrence, means we can suspect is a case of Behcets disease. So other patient may be presented with arthritis, uveitis, stomatitis, and various other features are associated with the Behcets syndrome. Here we'll only concise to the histopathological finding what we get in the histopathological slide in Behcets disease. It's not a diagnostic, but we can suspect it may be the case with the clinical history. It may be the case of Behcets disease. So, in this first picture is a scanner view of whole mouth specimen. If biopsy specimen, you can see from starting from here this side. From squamous epithelial lining, you can appreciate the various ulcer in the squamous epithelial lining, along with the significant finding of extravasation of erythrocytes on the surface. And squamous epithelial lining shows acanthosis, spongiosis. You can appreciate the vacuolation on the skin with the various ulcers. So, first is superficial squamous epithelial lining and elongated ridges with extensive, when we go deeper in the subepithelial zone and the dermis, the severe inflammatory cell infiltrate which destruct the whole the dermis, epidermis area. You can appreciate here in the next slide. I will show you the next slide. Let's see the next picture. In this is the subepithelial zone and the dermis. There is characteristic finding as you can appreciate the whole the tissue is destroyed by the severe lymphocytic and neutrophilic infiltrate. Neutrophilic infiltrate is a significant. You can see the hair follicle. This is hair follicle on the left side, and around the hair follicle there is a severe acute inflammatory cell infiltrate along with the lymphocytes and macrophages. This is known as folliculitis. Extensive destruction of the collagen connective tissues we can see here, and this is on the right side. The circular structure is a blood vessel in the dermis. So all the blood vessels, either the small and medium sized blood vessels, are involved in the case of Behcets disease. Can you appreciate this lumen is blocked by the thrombus formation along with the thickening of the epithelial lining? There is a fibrinoid necrosis, severe acute neutrophilic infiltrate in the vessel wall. This is known as leukocytoclastic vasculitis. So because of the extensive vasculitis, you can appreciate the severe neutrophilic and lymphocytic infiltrate in the whole the dermis and the epidermis. The inflammation extend to the base of the ulcer is also the characteristic finding in the case of Behcets disease. And you can here you can appreciate there's a fibrinoid necrosis in the vessel. In the center you can see the vessel and the surrounding perivascular neutrophilic lymphocytic infiltrate along with the hair follicles, and severe inflammation, perivascular inflammation, folliculitis, fibrinoid necrosis, vasculitis, leukocytoclastic vasculitis. And because of this vasculitis, the vessel wall is destruction of vessel wall occur, and this leads to extravasation of the erythrocytes is also the diagnostic features on the histopathology for Behcets disease. In this next picture you can also appreciate this is vessels with extensive neutrophilic infiltration, fibrinoid necrosis, and the whole the ulcer is destroyed by this severe inflammation. Here are the few points. What you get in the squamous epithelium, you will get the acanthosis, spongiosis, ulceration, subepithelial zone, and the dermis show the central necrotizing suppurative inflammation, which mainly comprising of neutrophils along with the lymphocyte macrophages, which is extending till the base of the ulcer. It's a diagnostic. Folliculitis, perivascular neutrophilic infiltrations, endothelial line swelling, extravasation of erythrocytes. These all are the diagnostic features. The vessel walls are thickened, showing the fibrinoid necrosis due to extravasation of neutrophil because of exudation of the neutrophil. This is known as leukocytoclastic vasculitis. And in vessels, you will get thrombus formation. In any vessel, you get thrombus formation. It affects the small vessel, medium-sized vessel, and the large vessels. So these are the characteristic features of Behcets disease, but these we can't make the confirmed diagnosis. For confirmation, we need the other test. So we advise the clinical features suggestive of the histopathological features suggestive of Behcets disease. Advise HLA-B51 test. We use the EDTA. We send the EDTA blood to the lab for HLA typing, in which the specific HLA, HLA-B, and in the specific HLA-B, HLA-B51 is a diagnostic for Behcets disease, and clinical correlation is also important because it affects so many organs. Okay, thank you.